Africa Science Dialogue, closing the gap between science and society.
Welcome back to the Africa Science Dialogue podcast, where we talk a lot of science in a very simple language that you will appreciate. Today, I have Professor Salome Bukachi with me, and Professor Bukachi is a professor of anthropology at the Institute of Anthropology, Gender and African Studies at the University of Nairobi. She is a member of the One Health High-Level Expert Panel and the Kenya Lead Multiplier for the COHISA project in Kenya. Professor Bukachi is here with me. Professor, how are you?
I'm fine, thank you.
Good. Thank you for being on this podcast with me.
It's a pleasure to be here.
For the benefit of the listener, tell us, what do you do as an anthropologist?
All right, thank you very much. As an anthropologist, I do very many things. I would sum it as working with a community, being the voice of a community in terms of bringing about their cultural aspects, their social aspects to the fore, to help in developmental issues. And this means that development has to take into consideration the people's diverse cultures, their contexts, to ensure that interventions are appropriate to communities. So when I just talk about anthropology, anthropology is about the study of humanity. It's about studying the human being from a holistic perspective and across different geographical regions, across different spaces, bringing out the issues that make us different. We are similar but different across different geographical spaces, across time. So just understanding what are the similarities and differences in human beings, and what are the things that make us different or similar. What are our cultural practices, looking at the totality of the human being, both his physical, biological aspects, his cultural, his linguistic aspects, language, how he speaks, the language they use for communication, all things that entail culture, and how that is important towards just understanding who we are and how we do what we do and why we do what we do and why we are different from each other.
Okay.
Yeah.
In the introduction, you mentioned something to do with One Health. So what do you do in that capacity as well?
So within One Health, I do a lot of things. And I can say I started working in the One Health space from a long time ago. When I cleared my master's, the first more or less permanent job I got was with a government parastatal, a research institution that was looking at trypanosomiasis control. And so I was part of an interdisciplinary team that was working in Kenya, but also in the region, within the East African region, doing research on trypanosomiasis, both in humans and animals, to see what are the best interventions and how can we work best with communities to be able to control and manage the disease. So I was part of the team as a social scientist, bringing in my skills, my experiences in anthropology to help deal with this, the disease. So besides that, working in that institution, I have built up over time my skills and my experience in dealing with diseases that cut across human beings and animals, what we call the zoonotic diseases, to be able to just provide information, provide evidence that can be used to inform interventions. As a result of that, I've also been selected as one of the panels of what we call the One Health High-Level Expert Panel, which is a global panel that is providing scientific evidence, research, and policy guidance to the quadripartite, that is the World Health Organization, the World Organization of Animal Health, Food and Agricultural Organization, and the United Nations Environmental Program, giving them guidance in terms of scientific evidence and policy guidance to be able to undertake One Health interventions globally. Yeah.
Oh, that's a mouthful. Now, when you go and in your role working with working in One Health, definitely you understand people, cultures, where they come from. What are some of the most interesting things you have seen now working in One Health that probably without like a person who understands people and culture and their holistic being, that will not have been factored in? What is one of the most important roles that you feel you play in that position that probably would have caused problems if that role is not played by somebody who understands the culture?
One of the things we call ourselves sometimes as anthropologists is that we are cultural brokers, meaning that because we study culture, we are able to understand the different facets that entail the social, the cultural aspects of communities, and how those become critical components that are important to incorporate in interventions. We've come across interventions. Maybe I'll give a case study or a story that I came across, was told to me, and how what we do came in handy to help avert some situation. There was a time mosquito nets were distributed in one of the communities in Kenya, and suddenly everyone returned the nets. These bed nets were distributed let me not say for free, but the communities were given, I think it had been subsidized, and so the communities were being given these nets without a cost on them. And these were bed nets to help deal with malaria. We know that bed nets are effective if well used to prevent transmission of the malaria parasite from mosquitoes to human beings. And so this project was a good project that was going to help this community. But just because one member of the community had some wrong information about these bed nets, suddenly information started spreading very widely in the community. The next day, most of the people who had received the nets returned the bed nets to the chief's place. They said, we don't want these nets. There are things around them. And some of the things that were now coming out around the nets, the misinformation was that the nets are, what do you call it? How do you put this in English? There's Majini. It was a community from the coast. And so it was saying that those nets are kind of that they're ghosts. Yeah. They are cursed.
They're haunted.
They are haunted. Yeah. And it's some children have been strangled in the nets as they were sleeping, and so they didn't want those nets. The second thing was about the color of the nets. In that community, there's a lot that is related to the white color. The nets were white in color, and so for them, they attributed this as now those ghosts, you know.
Yeah, I can see why.
They returned those bed nets. And this rumor spread round, and so it was just one person who may have had an incident in their house. Could be the net maybe by mistake came off and the child rolled over it, and so somebody assumed the net was strangling the child. We are not very clear on exactly what happened or how that rumor started spreading, but it soon spread like wildfire in the village, and the people who had the nets returned them. And so studies were done to understand what is behind these bed nets, because at face value it's very easy to say that community is backward. Why would they refuse the bed nets? Yet we know the bed nets are effective. But instead of castigating the community, a study was done just to go and talk to the community and find out what happened. Why are you returning the bed nets? And in that conversation, in having that in-depth information with the community, some of these issues came up. And so the intervention team realized that there was some information that they didn't have about the social context of the community, about the cultural context of the community, that are very critical to take into consideration when developing interventions that will be used by the community. And so one of the critical lessons we learned from that is that co-creation of interventions with communities is very critical towards increasing adoption of the technologies. And the second thing from my discipline is that the socio-cultural context in which interventions are being implemented is important for us to take that into consideration. We need to do studies that help us understand what is the social context of this community, what are the cultural practices, how do they relate with each other, who are the gatekeepers in this community, who do you need to talk to when you come to this community, how do you interact with the different members of the community. Just not understanding those contexts may end up getting somebody who has a very good intention thrown out because they did not understand those contexts.
Yeah, here. In this ghost net story, which is an interesting story, I actually heard another story. People were given nets and they started using them as wedding gowns. Anyway, in this net ghost story, where do you come in? When do you come in yourself now in your role as the anthropologist? Do you come before the nets are taken to the community, or do you come after there is noted resistance to try and... Where do you come in? Way before to engage with the community or later?
We need to come in from the beginning.
Okay.
And there are several stories about how, I would say, biological scientists have come up with interventions without including the social science aspects, without including the community, and things then go wrong. And that's when they think, let's sit with the community and discuss about this. Let's bring in the social scientists to help us understand this. We are now talking about the One Health approach. And this One Health approach is about bringing in a transdisciplinarity component, meaning we are bringing people with different disciplines, with different expertise. We are bringing communities and learning from each other as we engage in our different, in solving a common solution. But all the disciplines are represented, the relevant disciplines, and the community is also represented, and not represented as only an end user, but they need to be represented as also co-creators of the technology from the beginning, so that their voices, their perspectives are taken into consideration as we are thinking we want to develop a bed net that would help, or want to develop an intervention that will help deal with the common diseases or to deal with the food security issues we are facing or whatever it is. They know best how they have been. They know best their situations, and their voices or their experiences would be critical towards helping even the bioscientists to come up with innovative interventions. So it has to be from the beginning, and it has to involve both the community also and even the social scientists.
Yeah, I see that. And over time, because you have experience in this field for years, have you seen a change in how you deal with society and how they perceive and actually finally adopt some of these things with the proliferation of misinformation and disinformation also? Because of course we have more internet penetration and it's increasing over time. So does that make it more difficult for societies, because now they can get more theories coming up and probably people are not well informed and they're bombarded with beliefs, and so does it keep on getting increasingly difficult? Have you noted any change as social media keeps on getting more prevalent?
Yeah, of course. There's been an evolution in terms of how communication reaches different segments of the community. Right now with the social media, communication, you can say, is at the speed of thought. I'm just thinking about it now and already it's out.
Yeah.
We are talking right here, right now, and already the whole world knows about what we're talking about. And so because of that, social media is a good platform. as we say in anthropology, that technology is both, culture is adaptive and maladaptive. And technology is one of the components of culture, because it's just how do we adapt to our environment to help us survive in an easy way. And technology comes in to help make life easy. Social media has come in to make life easy. And any other improved digital methods of communication have come to make life easy, so that we can reach a wider group of people in a short time with the information that we have. But if not used and managed well, it can also reverse the gains that we are making in terms of the wider reach. So rather than rubbishing social media and saying it's not good, as scientists we need to learn, embrace it, and learn how can we leverage on the power of social media to be able to reach to communities that need to be reached, to be able to pass the information we need to be to pass, so that people who need to get that information get it at the time they need to get it, and in a timely manner. But of course, we know that there's been the downside of it also, where information that is not right has gone out and informed perspectives. And that has kind of done damage to some of the very innovative programs that have existed. And so it's important that as scientists, when we are working on different things, different interventions, we're doing research that is producing information that is useful to pass across, that we incorporate the communication strategies from the beginning. As scientists, we have been, it has been, one of our weaknesses has been that we have not been working together with communication specialists from the start of our research. We sometimes bring them at the end when the story is now, we've done our research, we've produced the evidence. Yet I've seen that when we work with communication strategy people, they can already pick stories from the beginning that can help shape how things are evolving. So that by the end, in case there is a miscommunication, communication has already started from the beginning. We don't have to wait to the end to communicate our end results, but we can already start working with the communications people from the beginning, work with the communities from the beginning, let them be part of the story of this research journey we are taking, so that in case there's any rumors out there, they'll be very quick to even be the ones who will dispel it and say, no, we have been with this group from the beginning. This is how our journey has been, and so those are not stories that are correct. Yeah.
I'll stick to the case study you gave of the mosquito nets because it's a very interesting story. Now, there is that cultural belief, or somebody who is known to the locals who was that story that people end up running with to reject some tech that's coming in. You, as a social scientist, you are also coming into a society as a stranger. How do you create trust? And you've spoken about how information should, people should have that information early on. But how do they trust this information? Or you, as the social scientist, and you're a stranger, will they trust you over their cultural beliefs?
One of the hallmarks of anthropology is about conducting ethnography.
Okay.
And ethnographic research is where you get immersed in the community to learn about their ways and learn about how they do their things, to help us understand much more. And it entails the aspects of building trust from the beginning. So as researchers, we do not just go to the community and start asking them, okay, so tell us, we are doing a study on malaria. What do you think about mosquito nets? There's the aspect of building rapport. And the building of rapport takes time. It's not that you just come in and walk out. It's about understanding who are the key people you need to sit down with from the beginning, introduce your study to from the beginning, and knowing what we call the gatekeepers, knowing the custodians of the community, who you need to enter through for you to get acceptance in that community is very critical. So we normally start our studies by doing visits to the community having understood who are the key people in the village, get to talk to them, get to explain what you're doing, and in the process, at least they see you give them the respect of who they are. And once you have the discussion, help them understand what it is, they will then be able to introduce you to the rest of the community and tell you, so-and-so is doing our research here. We know what they're doing, so give them the right support. There are also then the meetings that you have also with the community. So you can call sometimes what we call in Kenya the barazas, where the village head can call a group of people, maybe key leaders within the community, and have a sit down with you and explain what you're doing. They ask you questions, and once they are okay that what you're doing is okay for their people, then they give you the go-ahead to work with them.
Yeah.
So those are some of the methods that we work with to just get and build trust. It's also about understanding that because trust is not just something you build once, but it's a relationship. So it's about building a relationship with the community. It's about trusting, respecting the ethos of that community. And when communities see that you respect them, you respect their way of life, you're not coming to tell them your way is not right, but seeing how you can work with them to improve on what they're doing, or learn from them to also improve on what you're doing, then they start opening up to you. It also takes involving the community as part of your research. So we also work with the local communities. We usually get, for example, we work a lot with our students, and our students also come from these communities. So incorporating some of the students from those communities to be part of our research team also then helps to build trust with the community. Yeah.
Okay. Do you tend to get a more difficult task when you are working with communities that have probably lower levels of education? Do you feel like it's pegged on that?
When you work with different communities, you understand that not all communities are able to understand the language you're using.
Okay.
That's one of them. And also the literacy levels in some places are low. So if we use the mainstream research methods, it becomes very difficult and challenging. And so what we have had to do is use what we call the participatory methods. And these are methods that use material that are locally available, that the community can see around to interact with. So rather than talking about, give us a percentage of how many people use bed nets, maybe we do what we call either proportional piling. We have stones, and we say, out of these 10 stones, how many people do you think use bed nets? So they will put 2. Then now you can be able to say this is 2 out of 10. So just using those kind of methods that the community also participate in it, and even with their low literacy levels, they're able to be part of the study. So there are very different methods that we normally use that engage the community, that make them feel, it's almost like they feel like it's a game, they're participating in something, and they feel that they're even with their low level literacy levels, that their thoughts and their ideas are also taken into consideration. That really lightens them up. You should see them engaging, and everyone wants to draw a map of their village to show you, this is where we have situated this is where the hospital is. Just doing those participatory mappings with the community really interest them, and you're able to get a lot of information from the community using those approaches that would be useful towards our processes.
They own the whole process, right? From that point on. Do you have a particularly interesting and successful case study around this whole One Health thing, where community, for example, had a change of mindset that was so successful that you may talk about? Do you have any top of mind, maybe? Or one pretty unsuccessful one? It could be either case. Because like I would want to know in the malaria situation first and foremost, did the community finally accept the nets?
So now what had to happen is that also the intervention program had to then realize, because you've seen in Kenya we have different color of bed nets.
Yes.
So it's just deciding, okay, which bed net would be more appropriate. Maybe we take the green one in that place rather than the white one.
Okay.
Yeah. So if I talk about a study where communities have picked up an intervention and maybe initially were not, there are several factors that actually hinder communities from picking up interventions. And of course, it could be aspects of communication, of miscommunication, not having the right information. Others could relate to economic factors, the distance, and among all those. I'll give an interesting story from, it was not a health-related project, but it was a project that was going to build the livelihoods of the community, just to support the livelihoods of the community. There was this organization that wanted to give, we know of the cash transfers, where cash can be sent to communities based on whatever criteria is used and which specific community is, what aspect in the community the organization wants to deal with. So in this community, they wanted to empower the community and just help to empower the local economy through providing cash to community members to improve their livelihoods. So when the organization, they did an assessment to find out which of the households were needy and required to be given the cash transfers. They did not specify what they needed to do with the cash transfers.
Okay.
They just knew they were just looking for communities, members that were needy, and provide the money and let them work with it. So when they did the assessment, they identified the communities and they started distributing money. But before they distributed money, they gave the community funds, because the money was going to come directly to the different members of the households. The rumors started flying that, oh, this organization is Illuminati, or they are going to kill our children. And one of the interesting things is that when these people were given a phone, they were also given some sugar, just some supplies in the beginning. Community members started saying that phone they were given is, I don't know what kind of phone it is, that when you want to charge it, you just put it under your armpit. And it just charges. So they were like, this is something satanic. And that the sugar that they were given, it does not end. No matter how much they use it, that sugar keeps replenishing. So because of those rumors, even households that were needy and were already recruited refused. There are whole villages that said, we are not taking that money. We don't want. And so they were not recruited in the program. There were those who were okay, they were recruited and they were sent money. We came in now after the program had stopped, and we were now evaluating how those cash transfers, the impact it had on the community, on the households, and the market. And we found people now talking about, oh, we also want the money now.
Oh, okay.
Are you people recruiting? So they thought we were now recruiting the batch 2 of the people to be given the funding. And why was there this change of mind? What we realized was that people started seeing that those who got the money ended up changing their housing structure. They were now not using grass thatched. They had iron sheets because they had money. Some of them started business. They were able to pay for their children's school fees. And so they started seeing that things are really working for these people, and they started desiring to also have that money. So what did this evaluation teach us? It taught us that in situations where there are interventions that are there misinformation in the community as a result of maybe how interventions are implemented in the community. When you have case studies of people who have implemented that intervention, others start seeing and also realize those were just rumors. We also want now to buy into this intervention. So one of the critical things I see is having people who already pick up an intervention, who are ready to run with the intervention, work with them, let them run with the intervention, and they become then the ones who will also show the others that there's a case study in the village we can see. Their children did not die after they received that money. Their children have gone to school, look at them, they're doing well, they're okay. So those become some of the aspects of case studies. Role models in the community can help dispel rumors in the community.
Yes.
Yeah.
Wow. And also in the context of One Health, do you have any like One Health case study which was on either side? And now, because I know that when you're talking about what people really value most, definitely some of the things that have to do with their personal, with their lifestyles and personal health and their livestock, and like some of these things are really, really emotive. And probably we have seen stories about animal vaccinations, livestock vaccination, and what people, like, do you have a particularly more distressing situation when it comes to matters to do with One Health, for example?
So I'll talk about a livestock project. We were doing a study on gender and livestock vaccines and women empowerment. And within this project, we were working with poultry, and we were working through groups, farmer groups in one of the communities. So we were experimenting to different models to see which model would work towards ensuring that more farmers are reached with vaccination, and which model also works in terms of ensuring that the uptake of vaccination for poultry is high. So one of the models entailed offering vaccination at no cost to the community for their poultry. What happened is that when we did, so we had different rounds of vaccination. We would organize for vaccinations and then have them done at different times. I think we were running them in 2 seasons. We were working as a group of interdisciplinary team, so there were vets in the team. When we did the first round of vaccination of the poultry, there were some deaths among the poultry. And of course now when other farmers heard that chicken died after we did the first round of vaccinations, they were like, oh, those people brought drugs that are not good, that are making our chicken die, so we don't want
they
to...
hit their chickens.
Some refused that we can't go into their homes to do the vaccination because they didn't believe the vaccinations are good. How did we dispel this misinformation? We had to sit down with the members of the community and had the vet explain to the community how the diseases in the chicken come about. And it happened that at that time when we were doing the vaccinations, the chicken already had been infected with one of those diseases.
I see.
And so whenever you do the vaccination after a chicken or a poultry has been infected, it doesn't really work. So we had to sit down with the community and explain to them about this disease and how it occurs in the community and how, when vaccinations work, and also for them when vaccinations have to be done, that this has to be done prior to the outbreak of the disease. And so that helped us to at least get some buy-in together, because we now had to work with the local vets in the community and the local leaders. So bringing them on board helped at least to make the community start building the trust again. And in the second round, they were now more willing to also bring their poultry for vaccination.
Ooh. I mean, I think I'm interested in what you do. I think I will also be very interested in going to talk to communities and just guide, because like for you, I know in advance if the community is going to accept or if there is going to be skepticism around something, right?
Well, you can't know in advance because again,
you've lived with them for some time.
I mean, you can. You can know the processes that you need to know to do to be able to get buy-in, but sometimes human behavior sometimes goes different ways.
Okay.
Yeah.
I see. So now, thank you very much, Professor, for, I think this discussion can go on forever. A very interesting stories. I think the next thing I'm going to do is come with you to the field, because I really, really will be interested in seeing how a mindset that probably is so fixed, and somebody who thinks that, no, I cannot do this over my dead body, finally starts seeing sense of something and accepts that wholeheartedly. I would like to see exactly how you convince them to do that. And even though it takes some people who are part of the community to buy in so that the rest can come in, I think you have one of the most interesting jobs around.
It's very interesting, especially when you get to work with people. And you've just reminded me of another story. I've worked in the area of sleeping sickness. And we had rumors in the communities when there was an outbreak of sleeping sickness in western part of Kenya. That sleeping sickness was as a result of being bewitched.
Oh, okay.
Yeah. And so when community members got sick, they did not want to be tested for the disease. They didn't want to be taken to the sleeping sickness hospital for treatment because of all those. There were a lot of rumors about what happens when you're treated, when you get to the hospital, about the cause of the disease and the treatment, that you will become impotent, you will not get children if you're treated with if you're treated for sleeping sickness. And it became a big problem to get particular members of the community to go for treatment, because if you're not treated, you die. You have to get treated for you to survive. So one of the things we used was also to work with former sleeping sickness patients who had gotten the disease and went for treatment and came back and they were okay. So they were the ones who now became our advocates in the community, just telling the people, look at me, I was once sick, you even knew I was almost dying, but as a result of the treatment, I'm here today.
Yeah.
So having those people who have gone through the situation also just stand up and talk to the rest of the community helps to also dispel those rumors.
Yeah, and I think increasing literacy levels definitely makes people more aware of vaccines and stuff.
A sensitization of the community helps.
Okay.
Yeah.
Thank you very much for joining us on this podcast, Professor. We hope to have you again and again and again and again as we try to see exactly how communities out there can respond to social scientists and understand a lot of technologies that are coming to them to change their lives. And appreciate them as scientists continue day in the painstaking work to make sure that the future is bright for each one of us. And like many scientists on this same platform have said, they also live within our communities. So the work they're doing is work that affects them. So it's work for them, for us, for the whole continent. Thank you for joining us on the Africa Science Dialogue. Thank you very much, Professor, for being here with us. I will continue with this and other discussions. See you in the next episode.
Africa Science Dialogue, closing the gap between science and society.